Hi, my name is Elizabeth Curtis, and I recently graduated from Williams College, and I did SIT's India Public Health Program, and I'm currently back in India on a Fulbright-Nehru grant pursuing public health research. I came to this program already knowing that maternal health was my main focus. I want to be a midwife, and I knew that I wanted to research maternal health and women's experiences of their pregnancy care specifically. So after we did our excursion to Bidaiche, I very much knew that I wanted to do qualitative analysis that looked at the maternal health care of Bidaiche in the way that SIT had already presented it to me, by looking at all levels of the system, looking at it from all sides, seeing how both healthcare professionals and women receiving that healthcare actually thought about India's policies, how they thought about the care that was available on the ground. And I was amazed at how much I learned in such a short amount of time. I had never done field work before, so this was all new to me, and to be doing it in India seems like a daunting task, to do field work for your first time. But the SIT staff helped me prepare everything before going, from Hindi classes, which we were doing the whole time, and helping me prepare interview questions in Hindi. The SIT staff helped me prepare before going, and it made me feel really confident going into fieldwork for the first time. So I knew that I wanted to be speaking with women in villages, so they helped me come up with questions that would be culturally appropriate and culturally sensitive to ask people about their experiences while they were pregnant and giving birth in government facilities, as well as talking about their prenatal care, and then talking to the community health workers, too, about the care they saw being provided versus how they saw the system actually working, because I saw them as a real intermediary between women and the healthcare facilities. And then I also interviewed medical officers and auxiliary nurse midwives who worked at the district hospital and community health centers. And I was amazed at how much I learned from just 4 weeks of talking to these people. From 4 weeks of talking to doctors and women who are living in the villages and their health workers who are helping them get to the facilities and get access to these resources, I was so impressed by both the structure and setup of the Indian healthcare system, and also amazed that there were still these huge dearths in access. But one thing that really amazed me about the SIT program was the balance that the professors and staff in the program were able to hit between both preparing us and supporting us and really holding our hand through learning about India's culture and how to take care of ourselves, and also letting us be independent and actually experiencing all of this for ourselves. I did not know that when I was coming to India, I was getting a new Indian family and Indian parents who cared about me, as much, if not more, than my parents did. My safety was their top priority. Honestly, I felt safer here than I have in New York and Boston, where I grew up. I think a large part of that was because I had someone from the beginning holding my hand, walking me through. I am so appreciative of SIT staff for really giving me at all at the same time, one of the challenging academically experiences of my life, while always making me feel safe and comfortable while going through that process. My homestay in Delhi was probably one of my favorite parts about my experience here. I got really close to my homestay family. I was able to practice my Hindi a lot with my grandmother, who was living at home with a family and didn't speak any English. That relationship that I developed with my homestay family is something that I'll carry with me for the rest of my life. I was so happy when my dad came to visit me at the end of the program, because we got to go have dinner with my homestay family, and my host dad and my real dad got to meet each other, and it was a strange experience of worlds colliding. India is a great place to study public health and global health generally. I think this program is a particularly good way to do that study, because we're not just looking at Indian healthcare system from an outsider's perspective, but we're actually talking to the people who are involved in it. And you're not just learning about this from an outsider or with a savior complex, but you're learning about what people who live here are doing and the challenges they face and the future they see of these programs.
whenever any college student tells me that they're slightly interested in public health or global health, or think they may be interested in development generally, or if a student just tells me they want a really great study abroad program, I can't help but
sing the praises of SIT's India Public Health Program, because it was just such a life-changing experience for me. It completely shaped how I saw my future and where I saw the direction of my academic study going. It encouraged me to do more field work and push myself out of my comfort zones in that front. I really believe that it was my ISP, along with excursions and workshops and just real exposure to this non-traditional learning environment, that got me hooked on doing field work and made me feel like my time in India was too short on my SIT study abroad program. So it inspired me to apply to the Fulbright-Nehru Fellowship, and now I'm actually continuing my field work that I began in my ISP, and back in Bright, I'm looking at reproductive health access and outcomes generally, and new reproductive health programs that are starting. And I'm so happy I have the opportunity to go back and continue the research that I began, that I became so passionate about during my time with SIT.